Hello everyone, today we are going to learn side determination and anatomical position of the hip bone. Now this is hip bone. It is also called as innominate bone just because it has no name, and it is an irregular bone just because you cannot define a clear-cut shape of it. Now we know there are three components of the hip bone. The superiorly oriented ilium, which is flat, which has got an iliac crest which is convex, and this iliac crest should face upward superiorly. Number 2, the acetabulum, which is a curve shaped depression forming hip joint with head of the femur, should face laterally. And number 3, obturator foramen should lie below the acetabulum, and it should be bounded in front by pubis and behind by strong and stout ischium. Okay, so 3 points you will have to consider. Number 1, iliac crest. Number 2, acetabulum. Number 3, obturator foramen. So which side it belongs? Okay, it is of right side. Now second easiest way to determine the side and to hold it properly is looking at the greater sciatic notch. Now this is greater sciatic notch which is lying posteriorly, and how to hold this bone? Simply just stretch your thumb and accommodate that greater sciatic notch into the first wave space so that you will easily able to hold it with the same hand that it belongs. Okay, so it is of right side and you can easily accommodate the greater sciatic notch with the first wave space, right? Now all the features we have discussed, the iliac crest, the acetabulum and the obturator foramen, will follow the same rule even if you are holding it with your first wave space. So this is of right side. Similarly, I have got left hip bone just to show you. Okay, this is left hip bone. Now how I determine? Number 1 is the iliac crest, which is facing upward. Number 2 is acetabulum, which is facing laterally, and the obturator foramen below. Now here again I have got greater sciatic notch, and with the same thing within first wave space I will hold it like this. So it is left side, this is of right side. Okay, now second thing is how to put it in anatomical position. Now for that you will have to keep 3 things in mind. Number 1 is anterior superior iliac spine and the pubic symphysis. Okay, I am bringing it closer. Now this is anterior superior iliac spine, the anteriormost bony landmark of the iliac crest, and the pubic symphysis should be in a coronal plane. Now for that you can use a notebook. Okay, and if you imagine it as a coronal plane, you will have to touch both the things to it. Okay, now second point is the pelvic surface of the pubis. This one, this is pubis and this is its pelvic surface, should be facing backward and upward. Now if you are holding it in standing position, so the pelvic surface of the pubis should be facing towards your face, backward and upward. Third point is the symphysial surface. This is symphysial surface of the pubis. Again I am showing it in closer view. See this. The symphysial surface of the pubis should be in a sagittal plane like this. Okay, so keeping all the 3 things in mind, 3 features in mind, this is how you should hold the hip bone in its anatomical position. Thank you.